Hello, welcome to Let's Talk. My name is Angie Cooksey, and I'm your moderator for this evening. Let's Talk is an interactive forum for students, faculty, and community and campus members to talk about health issues that are important to all of us. This evening, our program will come to you in two portions. In the first portion, we'll hear from our expert guest speakers. They'll talk with us a little bit about themselves, what brought them to the study of our topic for this evening. And then in the second portion of the program, after we've taken a quick break, we'll be entertaining your questions. You'll be able to send us questions in two different ways. You can call in at the number under the screen, or you can join us online on Facebook, and the address is also going to run at the bottom of the screen. Let's Talk, an interactive forum for discussion of health issues, is in its fourth year. It's the brainchild of speech communication professor Dr. Rosalie Shemansky-Aldridge. And Dr. Aldridge has brought this program to us in cooperation and funded and supported by the School of Humanities and Social Sciences here at Indiana University East. Let's Talk takes up important topics that we know are on the minds of our viewers, on the minds of our students, faculty, and community members. And tonight we bring the important topic to you of diabetes. I'm joined tonight by an expert panel. We are so fortunate that they've been able to find time to join us. To my immediate left is Matt Bailey. He's a pharmacist at Reed Hospital and an expert in this field. Also to his left is Christy Farrell. Christy is the manager of the Diabetic and Nutrition Center, and I probably said that wrong, I'm going to say it again, the Diabetes and Nutrition Education Center, also at Reed Hospital. And to Christy's left is Dr. Erica Kretschmann, a specialist in the treatment of medicine of the treatment of diabetes. I want to welcome all of our experts today. I'm now going to give each of them time to talk about the topic of diabetes. Diabetes, which has become a national and really a global epidemic. Not only is it injurious to our health and dangerous for us, but it's literally costing millions of dollars for our healthcare system to respond to this epidemic. Matt, we're going to begin with you and tell our audience, our viewers, a little bit more about yourself and what has brought you to diabetes, your passion for this field and this study.
Okay, thanks, Angie. Like you said, I'm a pharmacist at Reed Hospital, and I've been there for 7 or 8 years now. But my interest in diabetes actually goes back all the way to when I was actually diagnosed with type 1 diabetes when I was 13 years old. And since then it's just been a lifelong learning process. Continue to learn more and more about the disease every day. And it's kind of funny to think back about how much has changed since I was diagnosed all those years ago, and also what my perceptions or misconceptions about diabetes were when I was diagnosed, when I was really just a kid. But and when I was told by my doctor that I now have diabetes, that conjured up in my mind a lot of painful injections, one of the first things that I thought of. Not being able to eat sugar, not being able to eat foods I liked, and basically I thought that meant that I was not going to be able to lead a very normal life, and was fortunate to find out that is really not the case. And then I've been fortunate enough to be able to, through my job as a pharmacist, communicate with people and share some of those experiences about what it's like to live with the disease and how to manage it.
Tell us a little bit about the information that you've brought to us today.
Okay, well, I prepared a few slides to just kind of cover the basics of type 2 diabetes, and can just go ahead and jump into those,
please.
I guess. Start off with just the most basic question: what is diabetes? And to put it simply, either type of diabetes is basically just a chronic condition where blood sugar levels are higher than normal. And then the follow-up question to that, what is type 2 diabetes, kind of begs the question, why are there two types? So the two main types include type 1 where the body doesn't really produce any insulin, most commonly diagnosed in children and young adults. And then type 2, where it's more defined by insulin resistance, where generally, because of overweight and obesity, the body's producing some insulin, but not able to use it as effectively. It used to be called adult onset diabetes, and it is still mostly diagnosed in adults, but we do see an increasing prevalence in children as well, and that there is still a correlation there between overweight and obesity contributing to that disease. And by far, this is the majority of patients with diabetes, about 90% or more. And Christy and Dr. Kretschmann, feel free to jump in if you have anything to add. My next slide just kind of talks about the prevalence of diabetes in our state, and then breaks it down further to just Wayne County. In Indiana, this data was from 2009, which was the last data set that the Indiana Department of Health released, or that I could find, in 2011. They reported 9.3% of adults in Indiana have been diagnosed with diabetes, which is a full percentage point higher than the prevalence in the United States at 8.3%. Then on top of that, it's estimated that 3% of adults in Indiana have diabetes and don't know it. They've not been diagnosed. And then in our county, in Wayne County, the prevalence is 8.5%. So a little bit above the national average, but a little bit below the Indiana average. And again, this data is 6 years old now, so that's maybe changed. And I'd say it's most likely that those numbers have went up.
Matt,
if anything.
I have to say they've gone up.
Yeah.
Yeah, absolutely.
Yeah, I'm sure they have. I've seen some numbers out there.
You give us an important framework for us
Yeah.
to begin. Yeah.
9-10%. You know, that's 1 in 10.
Yes,
so.
it is.
Well, and unfortunately, some of the data that we have is dated back, and so that's the best that we have
Sure.
to give, but it's definitely gone up. As obesity rises, so does the prevalence of diabetes.
And folks might wonder why it is that data seems to lag a little bit behind 2015, but just for our viewers, we all know studies take a long time to get together, to get approved. So really, if data is a few years old, that is the newest that we've got. Of course, we hear reports that come from the news. Agencies that collect information quickly may not be as well grounded as the data that you deal in. So I know that our viewers may hear on programs different data, studies that have been done last month or last year, but even those studies that get published this year, the data was probably collected about 5 years ago. So
Sure.
you are fine to bring
Sure.
us the data that you brought us today.
Okay.
Well, and absolutely, no matter what year it was published in, we've just seen a consistent rise in
Yes.
the rates of obesity and the rates of type 2 diabetes, which are typically the obesity trend is ahead of the diabetes trend by about
Yes.
1 to 2 years.
Yes, great point. Matt, other key points before we put Christy and Dr. Kretschmann on the hot seat.
We can go ahead, and we can certainly come back to some of these things if we have time. Or...
Okay, well, you've brought up some important
Okay.
points in the first few slides that diabetes is an epidemic, and it's a compelling health challenge that we're dealing with every day. So, Christy, as manager of the Diabetes Nutrition Education, tell us a little bit about yourself, what you do, and how what you're doing fits into a response to this scenario that Matt has described for us in the research.
Okay. Well, I have been a registered dietitian at Reed for about 12 years and manage the Diabetes Nutrition Education Center, as you said. My passion for diabetes really stems from the fact that although we talk about it as a chronic disease, it is one of the few diseases that we can treat effectively if done well. And so now that we have Dr. Kretschmann on board at Reed, it just really, our program lends itself to really being able to help patients, and we use this terminology, get into the driver's seat of their diabetes management so that they are really directing what's being done to manage their diabetes versus it being solely the healthcare provider, which is really nice. So at Reed, we have a diabetes self-management education center and program, and work a lot with the physicians in the areas, patients, as well as Dr. Kretschmann's, and really try to ensure that they have the knowledge to be able to manage their diabetes, whether it be through diet, through exercise, through medication management, stress management, but then also Matt alluded to some statistics about people not knowing they have diabetes. We really need to make sure that we address those people as well in terms of trying to get them to do a risk test, get their blood sugar tested so that we can draw awareness to, maybe something that they don't know.
So I'm going to mix and match you two very quickly. Dr. Kretschmann, how would I know if I have diabetes? And Matt, can we show your slide that you've brought, common symptoms? And let's do this at once and how beautifully that will be orchestrated.
Well, unfortunately, type 2 diabetes and prediabetes often have no symptoms at all. So a lot of times people go undiagnosed for years with diabetes, and unfortunately that can lead to severe complications with their heart, their eyes, their kidneys, and their nerves. It isn't until you get to more of a significant elevation in your blood sugar where you start to feel symptoms of diabetes, and that's most typically increased thirst, increased urination. Sometimes I've seen patients who've woken up almost every hour to urinate at nighttime. A lot of times it comes with recurrent infections. So people, women especially, will experience more yeast infections or urinary tract infections, skin infections, sinus infections. Fatigue is often a symptom of diabetes. But most typically what we see is just that they come in for a routine screening and find that their blood sugar is abnormal without having any symptoms related to diabetes. And sometimes, depending on how long it can be, nerve damage or numbness and tingling is one of the more common complications that happen before people are actually diagnosed with diabetes.
So to tease that out, it might be the case that I'm going for a routine physical, and it may be my family doctor who might administer a blood glucose test just as a routine panel, or I might have symptoms that present. Now, some of those symptoms you describe sound maybe distinct to diabetes, but I have to tell you, about half of them sound like the flu. So how would I, as a patient at home, as a viewer at home, how would I sort that out? How would I begin to sort out, am I really experiencing symptoms of diabetes? Do I have a cold, the flu? What would begin to tip me off?
Some of these symptoms, in general, people feel thirsty, or they drink a lot, or they feel like they pee a lot. If it's an illness, it's typically just a temporary thing. Whereas with diabetes, if it's untreated or not diagnosed, those symptoms tend to get worse. So the thirst response gets stronger, the frequency of urination increases, or the infections just don't heal. I've had people who were treated with 3 or 4 courses of antibiotics, antifungals, before someone thought to check their sugar. I've had people who've had ulcers on their feet and have received treatment before people have looked to check their sugar. So unfortunately, it's sometimes hard for patients to be able to, or people in general, to be able to grasp it as even healthcare providers, because infections are a common thing. So how I would encourage the people who are listening is, if they have some symptoms and they're persistent, and especially if they have family history or they're of an ethnicity that carries a higher risk, like the African American population, Asian American, Native American population, to consider, or they've had gestational diabetes, they really should consider going in and getting a glucose evaluated, which could be a fasting blood sugar. That's how we can diagnose diabetes, or a glucose tolerance test, a random blood sugar, or even a test called an A1C, which gives us a 3-month average of glucose control.
Beautiful, beautiful. So Matt, do you then find that people come and present these issues to you at the pharmacy?
Not typically. Now, it might be a little bit different for me than some of your pharmacists out in the community. because I do practice in a hospital, so a good portion of my time is spent with inpatient management, even though we do have an outpatient pharmacy, and do certainly get phone calls from the public and things. It's not a question that I get very commonly, but all of your community pharmacists out there, I know, are a lot of times the first resource, the first person who a lot of patients go to with complaints, questions, things like that.
So it's more than likely going to come to you, Dr. Kretschmann.
Or the neighbors. I've had that happen a lot, where people tell me that they use their mother's meter or their neighbor's meter, which they're really not supposed to use any meter but their own, just for the people out there. But a lot of times the symptoms are other people catch, wow, you were really drinking a lot, or they're driving an hour or 2 hour trip and have to stop every 15 minutes to urinate. So a lot of times the symptoms are picked up by people who care about their loved one.
Dr. Kretschmann, we've heard from Matt and we've heard from Christy about what has brought them to the study and practice in the field of diabetes, but we haven't put you on the hot seat yet. It's
Really?
your turn. You've already felt a little warm. Tell us about what has brought you to the practice of medicine in this field.
Sure. So I am an osteopathic physician. I am in my 3rd year of practice at Reed Hospital. My practice is called Reed Endocrinology Center. I'm lucky to have a wonderful nurse practitioner who works with me by the name of Susan Beauchamp. I actually decided to pursue medicine because, like Matt, I was diagnosed with type 1 diabetes at 15. And hopefully, unlike Matt, I was told early on that there'd be a cure. And my young mind said, I don't need to worry about this. I'll just do what I need to do and get my cure in a few years. And when I went to college, reality kind of set, and it wasn't the case. And I realized I need to do something different about how I approach the disease for myself. And being able to find my passion for it made me realize that I want to help other people be able to find that key. So I got the crazy idea to go to medical school and then do 5 years of training so I could be an endocrinologist, and it has been a wonderful fit for me. Endocrinology is a fascinating field. Diabetes is the majority of what I do, probably about 60% of my day. I see patients both with type 2 diabetes, type 1 diabetes, and an array of other hormonal problems like thyroid, adrenal, pituitary. But of course, I definitely have a passion related to my kin or my friends out there that do have diabetes.
So much associated with our endocrine system, just
Yeah,
incredible.
absolutely.
And this chronic disease, wow, part of it's tough because it's every day, it doesn't go away. Christy, it brings us to your door saying, how can I manage this every day? I've got a life, I've got kids. How do you help folks who bring all of this to your doorstep?
Well, I think first, really, something that my educators stress is understanding where a patient is in their disease process. So we talk a lot about stages of change and what are they ready and willing to do. And I think for a lot of people, having sort of all the tools in their toolbox ready to use is a big portion of what we do. Our job is to fill that toolbox, and then those patients can pull out those tools as they see fit. So diet is obviously a big area that we focus on, but kind of tagging on to what Matt said in his intro, one of the great things about diabetes is there's no food that's off limits, as you two both live and well know. And so it's exciting to be able to tell a classroom of people with newly diagnosed diabetes that, you can eat a cookie. You just have to account for it. And so that is a very big portion. Also, as I said before, learning how to look at the cause and effect relationship between what a person does and what the blood sugar result is as a result. Whether that be exercise, whether that be medication, whether it be physical or emotional stress, and then learning about the various resources that are out there so that they know how to, when they're finished with their education with us, they know how to move forward and really, as I said before, be in the driver's seat of their diabetes management.
I think that's incredible. And of course, along with the food and exercise comes medication. You know, when you get that diabetes diagnosis, type 1, type 2, there's medicine involved, Matt. And so all of a sudden, you have to become this pharmacist and this sort of quasi-physician to yourself, taking medicine, giving yourself shots every day, right? And that can present a real challenge.
Oh, it can. It definitely can. And there are a lot of options out there as far as medications, and that are, I want to stress, are used in conjunction with a healthy diet and with exercise. Especially in type 2 diabetes, you know, diet and exercise play maybe proportionally a larger role than in type 1, because there is the issue of weight loss and how much that can help lower the blood glucose. But as I mentioned in my slide there are a lot of new diabetes medicines. I think at least 9 just in the past 2 years. I'd say within the last 10 years we've seen a lot of completely new therapeutic classes out there, which has really changed diabetes management in terms of medications in a lot of ways. But some of the old meds that we've had for the longest time are still probably first line, cheapest, safest, most effective, but there are some new options out there, which is good. But one of the interesting things about diabetes is that you're essentially performing small tests on yourself each day, with each variable that you enter into your life. You know, what did I eat? How much did I exercise? What was my dose of insulin that I took this morning, or what was my dose of a pill that I've been taking, if that has changed? And then with self-monitoring of blood glucose, you essentially get to see how that affects you. And there are always some numbers that are hard to explain, but like Christy said, self-management is really the key, and being able to empower people to be in control, be in the driver's seat, and manage their medications along with diet and exercise, I think is, in the end, what's most important.
See, I left out lab technician, but we have to become that too, right? Right?
We do.
So,
we do.
you know, full disclosure, it's the panel of 3 diabetics, type 1 sitting here today. So, Dr. Kretschmann, when I've tried to manage my medicine and it's gone kablooey, I've tried to manage my diet and it's gone kablooey, I've tried to exercise and I've grown roots into the couch and become a couch potato, I'm probably going to come running to you, aren't I? Because I've probably gone out of whack. What are some of the things that are going to happen to me? Probably have happened to me.
Right.
When all of this becomes difficult, again, to manage on a day-to-day basis,
Sure.
that's part of the bugaboo, isn't
Right.
it?
Well, absolutely. I think everybody's brought up a lot of great points, and I tell this to my patients all the time, is that, you know, you could try to do the same thing, eat the same thing every day, and because of the variabilities of stress and illness and emotional, physical things, sleep, your sugars are never going to be perfect. A lot of times when people come to me, it's kind of in the later stages of disease management. And I want to reiterate, I think, the great points that Christy and Matt made is that oftentimes as healthcare professionals, we're so used to seeing people with diabetes because it is such an epidemic that we forget about the impact that it takes on the person that has diabetes. And really, if they can get the right education and realize that the best person to change their path of disease is themselves, they are going to live a much longer, happier life with diabetes. I don't want to see them having to come through my doors because they haven't been able to have that exposure and then already have the complications from diabetes. There's a condition called retinopathy, which is vessels bursting or bleeding in the eye. This is the leading cause of blindness, and there's about 24,000 new cases a year from people with diabetes. Nerve damage, this is often one of the most distressing problems or complications from diabetes. It can be just a numbness and tingling, like if your foot fell asleep, a sharp stabbing pain, your feet can be on fire, and often what happens is that the person doesn't feel their feet, gets a small injury, and then that could lead to a sore ulcer, and this is the most common cause of amputations. And really, since we have so many nice therapies out, I would love to not see anybody have to get their foot amputated anymore, but unfortunately, it's still the most common cause of amputations. Kidneys, diabetes is the leading cause of dialysis. And then there's also people who live with diabetes have a 5-time higher risk of having cardiovascular disease, which is heart attacks and strokes, and often at a much younger age. And then unfortunately, if the disease isn't managed, they have a shorter life expectancy of about 10 to 15 years. The last statistic I saw was there's about 215,000 deaths on an annual basis related in some way to diabetes, whether it's cardiovascular or complications from dialysis.
You've really laid the challenge on the table that we need to be thinking about what's going on in our lives, what our bodies are telling us. We're going to turn this program over to our viewers and let them call in or email in questions for our expert panel. We're so fortunate to have you here today. Each of you is an expert personally and professionally with a wonderful passion. We'll take a short break. When we come back, viewers, we're going to hand this program over to you. Get your questions ready. Call us, email us. We'll talk with you in a moment.
This is where a busy mom can work toward a bachelor's degree from a top national university during softball practice. It's where a service member can continue his college studies from anywhere in the world, and where you'll benefit from one of the country's most effectively delivered online programs.
Woohoo!
So, if you've ever wondered if a college education is really worth it, this is where you'll see that it is. This is Indiana University East Online.
Hi, I'm Tim Scales, the Director of the Center for Entrepreneurship here at Indiana University East. This segment of the show, we're going to learn from Beth Leisure from Cambridge City. We're going to learn about her business as well as the Chamber of Commerce.
The most important thing for us has been to make it clean and well lit, and we try to be friendly to people, and that works.
Watch In Your Business Tuesday night at 9:30 p.m. WETV Channel 20.
Hi, I'm Kathy Bridgeford with the Area 9 Agency on Aging and the host of Inside Area 9. Area 9's mission is to keep people living independently for as long as possible by providing services in the home. Those services are Meals on Wheels, caregiver support, respite care, as well as case management that can link you up to an array of in-home services. You can visit our website or our library located at our office for more information.
Hi, I'm Katie Cheney, co-host of Career Pathways. Join me for this month's episode when I'll be speaking with Nicole Mann and Alyssa Taylor.
Career Pathways is an introduction to some of the professionals in the Wayne County area and the paths they took from their degree to their current career. Career Pathways, produced by the IUE School of Humanities and Social Sciences, airs Monday nights at 9 on Wayne County's Education Access Station, WETV, Channel 20.
Welcome back to Let's Talk. We're in the part of the program now that we've turned over to you, the viewers. So we invite you to call in, to email in, to join us on Facebook. Let us know what your questions are about diabetes. I'm joined this evening by 3 experts, folks who work in the hospital with this predicament every day, this health challenge for so many Americans, so many Hoosiers, so many residents here in Wayne County. Just to reintroduce our panel, to my left is Matt Bailey. Matt is a pharmacist at Reed Hospital and a fellow type 1 diabetic. Matt's left is Christy Farrell. Christy is the manager of the Diabetic Nutrition Program at Reed Hospital, also in the Diabetic Nutrition Education Center. And to Christy's left is Dr. Erica Kretschmann, and Dr. Erica Kretschmann is a specialist in the treatment of diabetes. And again, Dr. Kretschmann, tell us your official title. You are a doctor of osteopathic medicine. Did I say that correctly and remember it correctly?
Yeah, absolutely.
Very good. Did I introduce you two correctly? Didn't say the wrong name. I got the right titles. So our viewers know we are in the company of learned community members. And that's what I love about Let's Talk. It's a program for our campus and community, but I am surrounded also by my neighbors and community members. And diabetes is a challenge that we're all facing together. It kind of takes a village to face this challenge. In the first segment of the program, we talked about this multifaceted chronic disease that needs really an attack from a lot of different directions. So when we left before break, we were talking about some of the challenges that can be presented when we may not know that we have diabetes, or we may know, but we might be like I was, in denial that we have diabetes, or we know that we have it and we've sort of accepted it, but day-to-day management is a real challenge. Some of our viewers are probably confronted with these issues and challenges, so we'll be anxious to see what questions they have to bring us. While we wait for the first question to come in, I'm going to return to you, Christy, because I think probably your position is as challenging, if not more challenging, because you're down in the dirt, down in the trenches with those of us trying to decide, is it a pear or a peanut? Do I reach for that cookie or the cantaloupe? In your experience, when folks come to you, is it control that is the biggest problem? That self-restraint, self-control?
Yes, to a certain extent, but again, one of the beauties of diabetes management is that we can take an individualized approach. So, no longer do we use a cookie cutter approach where we give everybody a certain calorie level diet and say this is what you should follow. It's really more about a carbohydrate budget, and you use that budget how you see fit. So if you want to use that budget with dessert, you use that budget with dessert, and as Matt said, you look at the cause and effect relationship between what that dessert does to your blood sugar 2 hours later. But certainly control is hard for not just people with diabetes, but for people without diabetes. That's why we struggle with an obesity epidemic, both in our adults and in our youth. So control is something that, as dietitians, we absolutely try to kind of guide patients to get a better handle on.
Well, I have to say that you're hanging on and hanging tough for somebody in those trenches. We do have our first question, so let's see what the viewers have sent in. How much does one's family history play into the likelihood or probability that I might or a person might develop diabetes? Dr. Kretschmann, I believe you had alluded to that earlier. Shall I pass that question to you at first?
Absolutely. Family history is a very big component of diabetes. There is a lot of unknown genetic, or a lot of different genes that we can have that we can pass on from your family to yourself that put you at risk for diabetes. There's not one certain gene. There is not one certain gene, but hundreds, maybe even thousands. I'm not exactly sure on where it is. They've been looking and researching for it. But what we know is that especially if a first-line relative, mother, father, brothers, or sisters have type 2 diabetes, you're at high risk of having diabetes. Even children of mothers who have had gestational diabetes, which is a condition where you carry diabetes when you're pregnant, they have a higher risk of developing type 2 diabetes throughout their lifetime. So yes, absolutely, family history, ethnicity, weight, carry a big risk for type 2 diabetes.
And of course, we don't choose our parents, and so, but the purpose of knowing it's connected is that if we know we're kind of in a place where we might be more likely, Matt, should we step up our rhythm of testing or just heighten our awareness that maybe we need to be listening a little more carefully to our body?
Well, I think just by letting your caregivers know that you carry a family history, that and the fact that that does maybe increase your risk would maybe prompt some earlier testing. But you know, everyone should be trying to pay attention to their bodies and any symptoms. But I think that having that knowledge in the back of your mind that, you know, I do have a family history would maybe bring that forward as a concern maybe a little bit earlier.
Well, the good news about trying to catch diabetes before it's diagnosed is that there's a lot of studies that have been done that show that you can reduce your risk of developing diabetes by about 60% if you manage your weight and you exercise regularly. And so by people really being aware before the diagnosis occurs, it enables them and empowers them to be able to prevent the disease and then prevent complications that Dr. Kretschmann alluded to earlier.
Christy, is that what we mean by pre-diabetes? Because we've probably all heard that term, we've seen that in the literature. What do we mean by pre-diabetes?
Well, pre-diabetes is where your sugars are abnormal, but not to the extent of diabetes. So your fasting blood sugars tend to be between 100 and 126, or you have blood sugars after meals that are slightly high, but not quite over 200. Unfortunately, this is a condition that is often missed and underdiagnosed. And if it was evaluated and treated aggressively with lifestyle, which is diet and exercise, that delay of progression to diabetes or putting yourself in remission from prediabetes puts you at a better place for your life. I wanted to add with that family history question too, you know, as a parent, you know, if you are the mom that has diabetes and you're worried about your children's risk, you know, one of the wonderful things about carrying diabetes and having that proper nutrition and lifestyle balance is that if you do your best, are going to be teaching your children ways to live healthier and longer, and hopefully keep in the right mindset so they don't have to follow in that genetic path.
That's beautiful. And again, just piquing our awareness of these kinds of risk factors that you've presented tonight, really important to us. We have another question that has come in to us, and Matt, I'm going to ask you to read it. It's a long one, and let us know what this question is that's come in.
Okay, the question is, I know there are studies that link diabetes with age and perhaps income, but are there studies that link it to education level?
I think this really ties into awareness. I don't know if you guys would agree, but again, I don't know that it's directly related to education level, but just having that level of awareness of what are the risk factors and what can I do if I am at risk. Can I go to a free screening around town at a local pharmacy or at Reed Hospital? Can I go into my primary care provider and ask them to do a blood sugar test so that we then can plan next steps?
I think you make a great point. We know that education is linked to potential income in the future, linked to maybe health insurance. Dr. Kretschmann, what happens if one of our viewers tonight thinks, I've got some of those symptoms, but I don't have health insurance right now. I'd like to get checked out. What sort of resources might there be for someone who knows, I need to get in?
Well, one resource available is the community health. You know, you don't have to have insurance to go there. There's also a lot of free clinics in which I would encourage them to go, and a lot of places offer free testing. I would encourage people who are concerned about symptoms to find someone who is in the healthcare field instead of a family member or neighbor, so they can be guided to what to do with that information.
Sure. And I think also that what you don't know can hurt you. Sometimes we think, ignorance is bliss. If I just ignore this, it will go away. But if we're feeling like we're getting some interesting signals from our body that we need to check out, Matt, we should probably check them out. We want to know. More is more here, not less is more, right?
Yeah, absolutely. Yeah, just being aware of those symptoms that we talked about can be beneficial. Knowing about your family history and other risk factors.
Yes.
Doing the most to educate yourself can certainly direct you in the right place if you do notice something that's out of the ordinary.
So, Christy, if I get somewhere and I get that diagnosis nailed down, how do I access diabetes nutrition education? Is that something that my doctor would refer me to, or can I come to the hospital and find your center? And do you have some free clinics and presentations that go on there?
Great question. So when we talked earlier about pre-diabetes, we do have a free pre-diabetes education program, and that's a class that's held once a month. Patients get a meal plan that's individualized. They get a free glucometer, which is what we're talking about, you testing your blood sugar with. And that is a great prevention piece that Reed offers. For someone who has a diagnosis of diabetes, oftentimes that's physician referred or provider referred. So that person would refer the patient to our services. We would schedule an appointment, and they have a couple of different options. They can go through the class series, where it's a program that we build on, or they can just meet with a diabetes educator one-on-one.
Oh, that's beautiful. And again, I know that our viewers, if they have questions in the back of their mind and they may be hesitating because of cost, and that really is a barrier for some folks, we want to encourage them to reach out, because there are some community spaces that have been made for just this very kind of response for them. So, Dr. Kretschmann, let's say that I've got the diagnosis, I've found that preliminary help. What if I can't afford my medication? What can I do? Are there places, resources, or websites, organizations?
Yeah, absolutely. First and foremost, you hit the nail on the head. Diabetes is a very expensive disease when you're looking at the cost of testing supplies, medications, how you deliver the medications, whether they're insulin. I run into this problem at least 10 times a day with my patients. Luckily, again, those resources in the community often do have medications that can help. There are some pharmacies that are now carrying some of the generic medications for free for patients. They do need to have a prescription, but there are still pharmacies that carry generic insulins that you can buy without a prescription at a lower cost. And one of the resources that I use frequently for my patients is financial assistance through the pharmacy companies themselves. So they do offer free medications for people who don't have insurance if they qualify by their income levels.
This is such important information for our viewers, again, because if we can get past the hurdle of just recognizing it and asking some questions, then we cross the hurdle of beginning to connect with help. Then if we can navigate that next hurdle of cost, what a wonderful way that we can begin to navigate through this chronic disease. We have another question. Let's take a look at what the next one is. Why does diabetes affect your eyes and your feet, Dr. Kretschmann? I'm going to toss that back to you, and then because we use those every day, Christy and Matt might be able to help us out here.
Sure. Well, there are a couple things that can happen with your eyes. And this can often be a symptom of diabetes before you're diagnosed with something called blurry vision. Sugar tends to increase and change the way your body handles fluid. So the reason you pee a lot is because the kidneys try to eliminate the sugar. Another thing that happens is that the eyes are very sensitive on levels of sugar in the body. So if the sugar tends to get really high, it shifts the fluid balance into the eyes, which causes them to get blurry. So people who could read a book at a distance may not be able to see, or the ones that couldn't do it and needed glasses may be able to see without it. So that's often why we see blurry vision. The vessels, or the retinopathy, when the vessels bleed, that sugar actually becomes toxic to the vessels, causing them to leak and bleed, and then that damages your retina, which decreases your vision and eventually leads to blindness. The nerves, there is a protective layer or a myelin layer over the nerves, and the sugars actually become toxic to that and kind of take away that protective layers, which causes the signals to go awry, and that's why sometimes people feel that chronic numbness or tingling or that sharp burning or fiery sensation, because the sugars are just taking away the protection on the nerves.
So it's not so much that the eyes and the feet are directly related, but nerves are directly related to both of those situations.
And yeah, again, the eyes are affected. The sugar does affect the way that the vessels are passing blood. So yes, it does directly damage the vessels of the eyes and the kidneys.
Some have even called diabetes a disease of the blood vessels, right? And so,
well, and it is too, because if you think about cardiovascular disease, again, people who have diabetes tend to carry more plaque through their vessels and arteries, which is part of the kidney and eye damage, but also why we see earlier onset of heart attacks and strokes in people with diabetes, because that plaque burden often comes at a much younger age, and why a lot of people with diabetes have to be treated with cholesterol lowering medications, because we want to prevent that early onset, and even blood pressure lowering medications, which can help protect the kidneys and the eyes.
It's so important. Again, it's a chronic disease, it's a daily challenge, but that ups the ante in terms of the kinds of negative consequences that we can have too. But Christy, we can manage this, right? If we get in the driver's seat.
Absolutely.
We have another question from our viewers. Let's see. What are insulin pumps, and who should use those? Who'd like to grab that one first? All right, then you can
start
toss
off
it
with
to
that
Christy.
one as an insulin pump user myself. So an insulin pump is a delivery device that allows us to get away from multiple daily injections with a vial of insulin and a needle, and allows insulin to be delivered at a continuous rate to provide basal insulin throughout the day, and also to then bolus for blood sugar that's too high or to cover for carbohydrates that are being consumed.
The cookie.
All without the cookie.
Yeah. In my case, candy. Don't tell Dr. Kretschmann I
Okay.
said
I
that.
won't let
Okay, move along that quickly.
But they're a huge benefit to a lot of people living with diabetes, by being able to get away with the needles or the insulin pens, and allow a lot more flexibility. I've certainly seen that in my own life since switching to the pump.
Christy, does that help us if we have less that we have to manipulate, take with us when we leave? Does that pump really give us a good partner?
I think it just offers less burden. The blood sugar testing, oftentimes there's a misconception that if you have an insulin pump, you don't have to test your blood sugar. You still have to test your blood sugar, but you don't have to carry around the insulin pen, the needles, the vial of insulin. And so it offers patients more flexibility, which is nice. The other nice part about insulin pumps is that because there's been a lot of research on the effectiveness of blood sugar control, insurance companies are covering insulin pumps more so for people with type 2 diabetes, not just people with type 1 diabetes. So it really offers a nice option for patients who feel like that's a good fit for them.
Dr. Kretschmann, would your practice corroborate the research? Do pumps make that positive difference that really pushes to a positive edge?
Absolutely. I encourage my patients to look and evaluate insulin pumps. I think anybody who is on multiple daily injections could benefit from an insulin pump therapy for the many reasons that Christy and Matt brought up. Also, I feel that it's typically the most specific regimen that we can get for somebody who is on insulin. And to highlight Christy's point, diabetes is an inconvenient disease. It is. And the more that I can get something to a patient that helps improve their ability to manage it, the better they're going to do in a long-term basis. And to me, there is nothing out there like an insulin pump to do that. In addition to that, these pump technologies are getting better and better. We now have some pumps that are released with artificial pancreatic technology, meaning that they're combined with a continuous glucose monitor that gives a blood sugar reading every 5 minutes of the day and can shut off insulin delivery when that blood sugar level gets too low that could be dangerous for the patients. And that's only going to get better where they're going to be able to be more responsive to not just the downs, but the ups of blood sugars too. So I think there's been so many things that have changed in pump therapies in the last 10 years, and we are going to see a wealth of change in the next 5 to 10.
And it can save our eyes and our kidneys.
Absolutely.
And improve the quality of our life.
And it allows you to be able to adjust at any specific time. So if you need to go exercise, if you need to have that cookie, I did hear you say that. That's okay though, because you can utilize something to prevent that effect, right? If you have the ability to say, I'm going to have this 3 Oreo cookies right now, and I'll give my 15 grams of carbohydrates for it, you're going to prevent that sugar from being 300, which then does decrease your risk of complications from the disease.
Yes.
So it allows you to be more specific to your disease. Or you can choose to have your chicken and broccoli with a nice salad and get the specific insulin that you would need for that too. So it allows you to really fine-tune that management.
And
now you can do that with insulin injections. You know, I have plenty of people who use it in a very advanced way that they can deliver it for what they're eating. It just sometimes is not as specific, or you can't change it right at the time that you would need to.
And those diseases, again, staving off the other further complications on down the road.
Yeah,
that's what
absolutely.
we're really aiming for
Absolutely.
in all that we're doing. We have one more question that has come in, and so let's see what our viewers want to bring us to. And it just, here it comes. Okay. Do you think that diabetes is more common now because of how our food is grown, processed, and I'll dovetail on that we're driving through McDonald's and Burger King? Is diabetes on the rise because of lifestyle, or is diabetes on the rise because of better diagnostic processes? Both? What do you think, Matt?
Well, I certainly think that diabetes is on the rise because of lifestyle. And our diets are certainly a large part of that. The food options that people tend to choose certainly maybe have went in a certain direction in the last 10, 15, 20 years or longer, and have contributed to the rise in obesity in this country and the corresponding rise in diabetes prevalence.
Newest research says billions of dollars are spent marketing to children, so we're even starting these habits early, aren't we?
We certainly have seen an increase in diagnosis of type 2 diabetes in younger and younger children as well.
Yes. Christy, what do you think about that? Are we diagnosing more because there's more stuff out there, or are we just getting better at diagnosing?
I think both. I think we continue to get better at diagnosing. I think programs like we're doing now draw awareness, but there are certainly environmental factors that play a part in our eating habits, our lack of exercise and inactivity, and so that lend itself to a sedentary lifestyle. And so I don't know that the processed foods are directly correlated with the diabetes, but probably in a more indirect way, as Matt alluded to, as being one of the causes for obesity and the increase in that prevalence, and then the tie in with obesity and therefore diabetes.
You know, Dr. Kretschmann, none of these answers seem to have a, B, yes, no, black, white answer. Would you agree? Is it really all of these factors pushing the rate up?
Yeah, absolutely. We have, if you look at just the statistics from what we're doing as a population compared to other populations in the world that maybe eat differently and exercise differently, that's why we're unfortunately leading in some of the risks for diabetes, like obesity, and we're one of the nation's leading the number of people who are diagnosed with diabetes, because we really have changed the way we get our food, make our food, and sometimes it's that convenience of the food.
Yes.
And unfortunately, it's not it's more frequent than it should be. You know, we all need to have something convenient now and then, but looking at doing that on a regular basis very quickly adds weight, which again increases your risk of obesity and diabetes.
So it's this modern life combined with our modern work, combined with some of our other habits, like all of those electronic devices that keep us in one
Absolutely.
space. You know, even though we tried, WII, to get us up and moving, I'm not sure that it helped. Are we exercising anymore? Are we making any progress on that front? Maybe.
I think we are, but going back to a point Matt made earlier, I think starting with our youth is important. When we have a pediatric weight management program called STOP, and when we started this program, we very rarely saw a kiddo with type 2 diabetes. Now we're seeing lots and lots of kiddos being diagnosed with type 2 diabetes, and so if nothing else, you know, really trying to stress the importance of getting our kids active in ways that promote free play and doing things that they love and enjoy, so that we can prevent these kiddos from developing adult type diseases. I think that needs to be a drive for sure.
Excellent resources. So each of you and these wonderful resources you brought to us today can be accessed through the Reed Hospital website by contacting the hospital by phone if you don't have access to a computer. Even if you walked in the lobby, probably there at the information desk, you'd be able to gain some information about how to access this great information and this great support that you've talked about today. I want to thank each of you for joining us again. You have brought such expertise to our panel, and you've informed our viewers, our lives, and just our knowledge bank is really a lot richer for your contributions today. Any final pieces of advice, words of wisdom you'd like to share with our viewers to encourage them on their path to a healthy lifestyle, pre-diabetes, diabetes, or no diabetes? Final words, Matt?
I would just like to say that it's encouraging to know that this is a disease that you can probably have more control over than any other chronic disease that I can think of. So
Can be in the driver's seat, Christy. Final
right.
words for us?
Absolutely. Just really empowering people to, A, understand if they're at risk, and B, understanding that diabetes is a manageable disease that they can, as you said, be in the driver's seat.
Dr. Kretschmann.
I think in addition to what they said, that people with diabetes realize that they're not alone.
Beautiful.
There's a lot of people out there that are going through what they're going through, that are there to support them. They don't have to be in denial because this is a disease that they can manage.
And we are all illustration tonight of that, yes? Thank you for joining us tonight on Let's Talk. Join us for the next episode of Let's Talk. It will happen on February 24th on WETV Channel 20. Our topic will be teen pregnancy, and we'll be joined by 3 experts, again, who are living and working in our community. They'll bring us information about this particular challenge that faces us. They will bring us information about how to really lend support, how to connect young men and women with resources around our community, and our next Let's Talk will again present an interactive forum for you, our viewer, to bring questions, concerns, issues to our expert panel. Panel tonight on diabetes, thank you again for joining us and for giving us your time and for sharing all of the information with us. Viewers, I want to thank you for joining us here on Let's Talk. Again, Let's Talk is an interactive forum, a program supported by the University for the Community and for you, the viewer. Remember that you can call us, you can email us, just join us for the next program of Let's Talk. See you then.